house call. Dr. Brandy Patterson is here to talk a little bit about high blood pressure. You hear it about it all the time. Every time you go in, they take your blood pressure. What constitutes high blood pressure?
So blood pressure is basically the force of blood against the artery wall, and high blood pressure is excessive force against the artery wall. Americans have about a 90% lifetime risk of developing it. So it's very common, and if we live long enough, we're probably going to get it. There's a national committee that has defined normal blood pressure as 120/80 or below.
Okay.
Pre-hypertension is 120 to 140 for the top number. Stage 1 hypertension is 140 to 160, and then greater than 160 is stage 2 hypertension.
Can't just going in there to the doctor's office, though, that can make it elevate a little bit, right?
Yeah, that's called white coat hypertension, and that is actually a common condition where the blood pressure elevates every time a patient steps into the office and sees a nurse or the doctor or a nurse practitioner. And what we need to do at that point is actually give a patient an ambulatory or home blood pressure monitoring system to take home with them. And they typically wear it for about 24 hours, and then that way we can better understand what the blood pressure is during normal activities at home.
Who is more at risk?
So there are certain risk factors for primary hypertension. There's actually two different categories: primary or essential hypertension, which by far is the most common, and secondary hypertension, which is definitely much more rare. And that's caused by a condition with the kidneys or the endocrine system, and once those primary issues are corrected, then the hypertension resolves. But primary or essential hypertension, again the most common, risk factors include increasing age, a family history, poor diet with a high sodium content, 3 grams or greater. In fact, race is very important as well. African Americans tend to get earlier onset hypertension. They tend to have it more severely and have more end target damage, meaning they tend to get more strokes, heart attacks at an earlier age. They're much more salt sensitive than Caucasians and respond differently to blood pressure medications than Caucasians. One thing I do want to point out, though, is that over-the-counter medications that we don't even think about would affect our blood pressure, like non-steroidals, Sudafed, pseudoephedrine, when you're congested, those also raise the blood pressure, as well as excessive alcohol intake and obstructive sleep apnea.
Okay, what about treatment, and how does this affect your heart?
So it affects our heart in ways that we initially don't even know about. And so that's why it's called the silent killer, because we really don't know how it's affecting our heart or the rest of our bodies until we go to see the doctor, get an EKG or ultrasound of the heart and see changes. It leads to premature heart failure. It leads to premature coronary artery disease. Patients with hypertension have an increased risk of heart attack and sudden cardiac death, as well as an increased risk for ischemic stroke and bleeding into the brain, end-stage kidney disease requiring dialysis, problems with the eyes. So it not only affects the heart, but the entire body.
Very important to get it taken care of.
Yes,
Dr. Patterson, thanks so much for coming out today.
Thank you for having me.